Hey everyone, if you're watching this, we're nearing the end, only a couple weeks left here, and hopefully we can get back to some semblance of normal in the fall. So today our focus, we've been talking about international organizations, and given current events, we thought it was a really good idea to talk about the World Health Organization. And so our discussion this week is going to focus on the World Health Organization, or the WHO. So I'm going to share my screen with you, and we'll get to it. So, the World Health Organization, right? You've been watching the news in any capacity over the last couple of months. You've probably heard them mentioned. So our focus is going to be: who are they, what do they do, and what are they doing in relation to the pandemic? Okay. So in terms of an overview, so the World Health Organization is an IGO. Okay. They are part of the United Nations. Okay, so they're not UN, WHO. They're just the WHO, or the World Health Organization, but they are the health agency that is supported and funded in part through the United Nations. Okay, they get established at after the First World War, 3 years later, April 1st, 1948, and they are a non-political organization. Okay, and they're tasked with the challenge of providing leadership on global health issues. But as you can imagine, different states have different levels of healthcare and access and all of that. So how do you provide that for the entire world? So they employ about 7,000 people in 150 countries, and they break that up into 6 regions. We're not going to get into the details of that. Okay. And so their role is to coordinate and direct international health responses through the system of the UN. Okay. So we'll get into the details of some of the things and the work that they do kind of as we go through these slides. So how are they organized? Okay. So the World Health Assembly within the WHO is attended by delegations from all member states. So kind of like a government, right? Like kind of like the UN, where each country sends a handful of people, right? The World Health Assembly is no different. Okay. And it is this assembly that determines the policies of the organization. Now, that does not necessarily have to be adhered to by the world. Okay. So on the right here, you can see kind of how it's broken down. They have a director general, kind of like the leader. We've seen him on TV a number of times over the course of the last couple months dealing with this pandemic. They have the World Health Assembly, that kind of governing body. Okay. And then they have the executive board. Okay. The executive board is made up of people who are qualified when it comes to healthcare. Okay. And right, they are the doctors, right? They are the those we would rely on for public health advice. Okay. And they the advice that they give helps the health assembly make decisions. Okay, so they are the ones who are knowledgeable related to infectious disease and all of those other things. But the World Health Organization can't operate without partners. Okay, right? They rely on collaboration internationally in order to see their work go through. Okay, so the WHO, of course, partners with individual countries through the United Nations, through other international organizations, through right civil society, right? So regular people like us, right, through the healthcare systems. Of course, then foundations as well, because they rely on a lot of financial donations. Of course, academia in that idea of science, right? And research institutions, right? None of this would be possible without science and advancing of the various science to inform us of decisions. So partnerships is really important, that collaboration with nation states. Non-state actors, okay? For example, the Bill and Melinda Gates Foundation, they are a non-state actor that donates millions of dollars to the WHO every year. Okay? Expert advisory panels and committees, right? You have some people that are, really well versed in infectious diseases like Ebola, COVID, AIDS, for example. So they'll have their own panels and committees. You'll also have other panels and committees dealing with, for example, nutrition or vaccinations, or any of those other topics, maternal health, that revolve around international healthcare. Okay. International agencies for research on cancer, right? That idea of research and scientific advancement. Of course, the United Nations is a significant partner. Those last two bullets there. Where does the money come from? Okay, right? Money is an important part of the game. So the graph that you see here on the side, this is from 2018, 2019. It's the most updated information that I could find. And it lists the top 20 contributors to the WHO. So what you see in this kind of turquoise color, very technical, those are the dues. So that's the volume of money that countries have to give the WHO based on their membership within the United Nations. So that's the requirement. Okay? And the stuff in kind of brown, that is voluntary money that gets donated generally, i.e. it's not earmarked for a specific kind of topic, research, or whatever. So that's just, hey, we got some extra money, here you go. And then the money that is in light pink or pastel-y pink, that is money, again, that's voluntary donations, but it's tied aid, in that that country is donating that money voluntarily, but they're saying you must use it for this. And so that creates its own challenges, okay? And that, as you see out here on the side, voluntary contributions tied to specific initiatives kind of handcuffs the WHO a little bit, because the WHO now not only has the initiatives that they want to do, they also have to do these other things as specified by the donors, which complicates things a lot. And if you look at the money coming in, is more money coming from mandatory dues or is more money coming from voluntary contributions but with specific initiatives? And you can see most of that money is earmarked for specific initiatives from the donors. And so you'll notice the United States is by far the largest contributor and funder of the World Health Organization. Donald Trump just suspended last week, 2 weeks ago, all financial contributions to the WHO, pending what he says is an investigation into their collusion to cover up the coronavirus with China. You can get into that later. Needless to say, that's a big blow for the WHO. And hopefully that money gets restored because it is essential. You'll notice the Bill and Melinda Gates Foundation, they are the second largest contributor to the WHO. And 100% of the nearly $500 million a year that they donate is set to specific initiatives. And it goes on and on and on. So we've got 1, 2, 3, 4, right? Most of the donors of significant value are voluntary donors with specified initiatives. So the WHO has been, as this quote here on the top, increasingly dependent on voluntary donations, but that puts pressure on the organization to align those goals with those of the donors. And that may not be fair and equitable. So, overview of work. What do they do? Okay. Oh, I'll fix that. Should say smallpox, right? So they've done a lot of work with smallpox over the years to eradicate smallpox globally through immunization. So smallpox, immunization, tuberculosis, malaria. When you think about a lot of these, they're looking at not developed countries like Canada, the US, Europe. They're looking at developing countries in Africa, in Southeast Asia, in the Middle East. largely Africa and parts of Southeast Asia, right, to help those underdeveloped healthcare systems. Water and sanitation, again, similar regions. Neglected tropical diseases, HIV and AIDS, development of research and medicines, maternal and infant health. And again, right, in countries like Canada with well-developed comprehensive healthcare systems, the WHO doesn't play a big role. But in developing nations, they play a significant role in global healthcare. And of course, these last two, monitoring disease and global risk and responding to emergencies, which of course, as you know, we are in the midst of right now. So now let's shift our conversation and look at the role of the WHO through the COVID-19 pandemic. And I know that you guys have been kind of watching this over the last few months. So the timeline that I'm going to go through isn't super comprehensive. But it is going to highlight some of the big ideas. So we know that there was a doctor in China who kind of started to alert people that last week of December, kind of like December 30th, 31st, somewhere in there, to this alarming new disease that they were seeing in hospital. And so January 1st, 2020, the WHO sets up an incident management support team across all three levels of their organization, and basically starting the foundation for potential emergency responses to what at this point is just an outbreak in China. Okay. A couple weeks later, China shares the genetic sequence of this virus to the WHO, who then, of course, shares it with teams of researchers all over the world looking for a vaccine. And January 13th, the first case gets reported outside of China. By January 20th, the World Health Organization is in China. January 22nd, now they're saying, you know what, there's evidence of human-to-human transmission, and they establish an emergency committee. By the end of January, WHO is having emergency meetings with the Chinese government to try to figure out all of these things, right? And help in their response, oversee the response, because with SARS a number of years ago, there was a lot of misinformation and covered up information that they want to prevent from happening, because this is big. By the first week of February, the WHO releases their strategic preparedness and response plan. And then on March 11th, just a couple days before we shut schools down here in Alberta, the WHO declared the coronavirus COVID-19 a global pandemic. So where do we go from here? There's been this pandemic that's been established, right? The globe has shut down, basically, right? Air travel, trade, all of that, right, has really come to a standstill. So what is the WHO doing now? What is their role? Okay, so they have this R&D, a research and development blueprint, basically a global strategy and preparedness plan that allows them to do certain things. Okay, first being the rapid activation of research and development during epidemics, right? They have teams of people all over the world that are scientists and doctors working to, right, sequence this, develop treatments and vaccines. And so basically the R&D blueprint is aiming to fast track the availability of testing, vaccines, medicines, that can be used on a large scale, because historically speaking, right, research and development in medicine is fairly slow, right? There's lots of testing that gets done before anything can get rolled out, but we're in an unprecedented time. The testing and stuff still needs to happen to make sure that the vaccines and the treatments are safe, but there's this need to do it at an accelerated pace. And so R&D Blueprint is one of the ways that they try to do that. So what do they actually do, though? So 5 ways the WHO is helping, okay? So 1, helping countries to prepare and respond. So trying to be kind of that focal point of relevant, accurate, reliable information. countries like Canada may not need as much help to prepare as a country like, say, Sudan, right? Or Thailand, or right, some of these other countries. And so helping countries to prepare and respond is a really big thing, right? Transmitting of information, which is the second point, providing accurate information and busting dangerous myths, right? That idea of accurate information is really important. Because you want to ensure that everybody's on the same page when it comes to how this disease is transmitted, how to care for it, and all of that. But in the age of social media and fake news and everything like that, this idea of busting dangerous myths also becomes really important. Some of you may have seen that documentary floating around on Facebook last week called Plandemic, right, which has now since been taken down and banned due to conspiracy theories. But that idea that information transmitted so fast that there's so much inaccurate information out there, right? Case in point, was it last week or the week before, with that idea of injecting yourself with disinfectant, right? Or consuming in disinfectant, and then going, whoa, 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 whoa. Under no circumstance should you be drinking or injecting yourself with bleach or Lysol or anything like that, right? So that idea of busting dangerous myths to help keep people safe. Number three, ensuring vital supplies for frontline workers, right? They're not necessarily helping a country like Canada, but they're going to be playing an active role in Africa, in Central America, and in other parts of the world where their healthcare systems may not be as developed as ours, and their countries' supply chains may not be as established as ours. Training and mobilizing frontline workers. Again, this is more so looking at developing nations rather than nations like Canada. And then 5, last one, searching for a vaccine, right? This idea that scientists and doctors all over the world, are sharing their information and collaborating together in the collective effort to search for a vaccine that would help all of humanity. So, where do we go from here? So what our task this week is going to be is, it's not overly lengthy. There's a lot of different perspectives on the effectiveness of the WHO. So I'm just going to switch from the screen to the other one. So this is what your document looks like for this week. It shouldn't take you too long. Okay. Use the box below to explore the varying perspectives on the World Health Organization. Find 5 perspectives that support the WHO in their actions and what they do. Find 5 perspectives that criticize the WHO. Each bullet should explain or summarize the perspective in a mini paragraph, right? A handful of sentences. This doesn't need, it needs to be more than a few words so that we know you understand, but it doesn't need to be like 5 full-blown paragraphs, okay? So what are the 2 sides? They're effective, they're ineffective, okay, right? Donald Trump would be on the critical side, okay? And then the second part, okay, again, not meant to take you a super long time, is a discussion or opinion question, okay? How much influence do you think the World Health Organization should have on influencing policy decisions within individual countries or nation states during the COVID-19 pandemic? Okay, so what, if any, influence should the WHO have on Canada's decision making? Okay, for example. So develop one argument and support it with evidence in a paragraph. So you're looking at 8 to 12 sentences. Okay, what is your opinion on that? Okay, so that'll wrap it up for this week, right? Pound out that one page, send it in. We'll send you some feedback, and keep working hard. We're almost done. Have a good day, everyone.